So let's talk about the sunshine vitamin, vitamin D. So look at this. Vitamin D deficiency known to increase the risk of acute viral infection. So if you have a deficiency, and this is known, this is a study back from 2015. This is before the stupid SARS virus was out, right? So we knew that if you have vitamin D deficiency, you're at higher risk of acute viral infection. Tell me if the CDC ever tells you to optimize your vitamin D level, to minimize your risk of influenza. What do? Get a flu shot. That's all they got for you. Get a flu shot. Okay? Another study, 2017, taking vitamin D prevents acute respiratory infections. Okay? Again and again and again. There's a gazillion studies on vitamin C that are saying that it prevents infection. Okay? Now, so you can say, oh, okay, that's a virus, but how about COVID-19? Well, recent study here, okay? I want to share this with you. On the left is people that have a so-called normal vitamin D level. Now, to me, 30 is still low. I like my patients, because most of my patients are my patients because they're not well, to have a much higher and more protected vitamin D level. But so-called normal in most of our labs here, above 30, okay? Look at your chance of death, way down. On the right, if your level's below 20, look at your chance of death, way high. So vitamin D is essential for defending against respiratory infections. In this Indonesian study, nearly half the patients with inadequate vitamin D levels died. Only 4% of those with normal, so greater than 30 levels, died. That's a huge difference. This is 780 patients they looked at. And they adjusted for age and sex and, comorbid conditions. Vitamin D by itself as the only factor, if deficient, was 10 times more likely to result in death if you had a deficiency. Think about that. Have you heard about this study on, CNN yet or Fox? You're not going to. Okay? You're not going to. They don't want you to know this. They want you to wait for the vaccine. Here's another study. Okay, this is from the Philippines. Okay, you want to look at critical and severe, so the yellow on top and the gray below it. If your level is low, most people are in that severe and critical illness. But if your level's above 30, very few people are sick. So the chance of becoming severe or critical, if you were vitamin D deficient, was 73%. It was only 7% if you did not have a vitamin D deficiency, guys. That's a 10-fold difference. Who wants to decrease their risk of dying or being seriously ill? Raise your hand, everybody, right? But CDC is not telling you this. CNN's not telling you this. Fox is not telling you this. I'm telling you this. Please listen. So let's end this pandemic. Let's decrease the risk of severe disease by 90%. Let's decrease the risk of dying by 96%. Let's take vitamin D. Okay? Amazing. And yet you don't hear about it. Okay? I don't know. To me, it's criminal. It is totally criminal what this healthcare system has become all about. That stack of dollars is what it's become all about. And not only, it is. It's to me, it's not just negligence or malpractice. I think it's murder. Talking about vitamin D. So how much should you take? If you are little, an infant, about 1,000 a day is good. They make it in drops. 1 drop equals 1,000. A drop a day, 7 drops once a week works. Okay? Children. All right, so above toddlers, 2,000 a day is a good number. If you're an adult, for kind of an average maintenance, in my experience, it's somewhere between 3,000 and 5,000 a day. Okay, if you have not taken vitamin D, you need to take more, guys, to build your level up. Okay, so to me, a minimum that you want to target for is 50. My ideal is somewhere in the 70 to 80 range. But the medical doctors, most medical doctors, they see a level of 80 and they panic and they tell the patient stop taking vitamin D. So that's why I'll settle and I'll negotiate and I'll say, okay, target for 50 to 60. Then your family doc will be okay with it. You won't scare them. And you'll be protected because you're way above 30, okay? Always remember, I have to give you this disclaimer. You always got to check with your doctor before taking any supplement, even, especially if you have health problems, okay? Now, I want to make it easy for those of you that don't have a doctor or don't have insurance and don't know what your vitamin D level is. You've got to find out what it is, okay? How do you test your vitamin D? If you go to this link, and Jake, if you can type it into the chat box, please. Go to this link, you'll provide some basic information. We'll ask you for nothing more than a name, phone number, and date of birth, okay? For $35, we can get a vitamin D level done for you. It is that simple, okay? We can facilitate that. That's if you have no insurance, no worry, okay? If you have no insurance, and you try to run it through a standard lab, that might charge you $425. So this is by a very important piece of information. If you have insurance and your family doctor, ask them to test, and it'll run under your insurance. Okay, insurance will cover it. So get that done. If your doctor tested it and told you it was normal, don't settle, please. Call, ask, what was my vitamin D level, please? Because if it was 30, they're going to tell you it's fine, it's normal. Okay, well, I don't want to be the worst student in my class. So I don't want you to have the lowest, minimalist level. I want you to have a good, generous level. So please, if you need your level checked, reach out to us. If a computer, issues arise, call the office. Okay, we will help you to get that done.